Molluscum Contagiosum is a viral condition that can also present itself as a sexually transmitted infection. Caused by the Molluscum Contagiosum virus, it is in the pox virus family. Other viral STIs include hepatitis B, herpes, HIV, and HPV. Cases of Molluscum Contagiosum are hard to track in numbers since not everyone seeks medical care for the condition, but in 2001 to 2005, 22 out of 10,000 U.S. outpatients had Molluscum Contagiosum. This number has most likely stayed the same or increased since then, with the fraction for the recent British population being 261 out of 10,000 outpatients. Although this disease does not present itself as an STI in all cases, it is still serious when it is not classified as such, with 1 out of 6 Dutch children having been reported to have contracted the disease in a study. Molluscum contagiosum starts as a skin disease that is most often seen in children. It spreads through touching something infected with the virus, such as a towel or exercise mat, as well as spreading through skin-to-skin contact. Therefore, playing a contact sport increases the chance of getting the disease, as well as living in a tropical climate. Poor hygiene also increases the chances of contraction, as well as self-reinfection, picking and scratching at lesions and then touching uninfected areas of skin. Molluscum contagiosum is considered an STI because it is most often spread in adults through skin-to-skin sexual contact. When a patient already has an immune system weakening disease, such as HIV, their chances of contracting molluscum contagiosum and having a harder time fighting it off are increased. Additionally, the use of steroids and the presence of eczema in a patient makes infection more likely. Molluscum contagiosum is characterized by the presence of bumps or lesions on the skin. These lesions may take up to 7 weeks to appear after infection, but they may be the only sign of the disease. The bumps, 2 to 6 millimeters in diameter, sometimes up to 15 millimeters in diameter, are described as having a smooth, waxy, or pearly surface, either flesh-colored or pink, but become red as the body starts to fight the virus. The lesions are described as having a dimple in the middle filled with a white pus-like substance. They are painless but can start to itch, causing spread by scratching them. Discomfort, secondary infections, and inflammation can all occur, and the lesions are likely to stay for up to 2 months. In the case of an STI, the bumps are often found on the genitals, abdomen, and inner thighs, but the nature of the infection can also cause bumps to appear anywhere but on the palms of the hands or soles of the feet, most commonly on the face, neck, arms, and hands. There are usually around 20 lesions in any given area, but it is possible for there to be many more, and sometimes up to 100 can be on the face. Lesions can also merge to form plaques. Molluscum contagiosum can usually be diagnosed simply upon seeing the lesions, but a biopsy can confirm the identity of the infection. The virus will usually go away within 6 to 12 months depending on treatment method, and if left alone, will fade without scarring. The virus is no longer present in the body once the lesions fade, and it cannot be spread once it is gone, but the virus does not function like chickenpox, as you can get it again even if you have previously contracted it. If the infection is not severe and the patient has a healthy immune system, molluscum contagiosum will usually go away without treatment. Some common applied treatments, however, include cryotherapy, the use of liquid nitrogen, curettage, the removal of the skin making up the bumps with a small tool, and using a sterile needle or phenol-dipped stick to burst the lesions. Many applied treatments, such as these, require more than one treatment to be effective, usually spaced in intervals of 3 to 6 weeks. If an infected individual has HIV or another immune-compromising disease, antiretroviral therapy is an option to strengthen immunities enough to fight off the infection. Preventing this disease can be done through practicing good hygiene. Wash hands with soap and water, and do not share towels or sports gear that can come in contact with bare skin. If you already have the virus, keep the lesions clean and covered to prevent further spreading, and do not shave or use electrolysis where the bumps are located. Do not engage in skin-to-skin contact with someone who has the virus, specifically if you have a weaker immune system. Molluscum contagiosum is spreadable, but it can be prevented through knowledge of the disease and being careful.